I'm Professor Wallace. I'm the chairman of the International Law Institute, and I want to welcome you all. This is the fourth in a series on the coronavirus. Its emphasis will be a little bit different. In the past, we've emphasized mostly health. Now we're going to be moving away from that, and I think we all see that there's a sort of a tug of war in the world between those who put health first and those who put the economy first. Since this is a diplomatic conference, we might mention the president of Brazil, who seems to be very much on the economic front. And I think this panel today will explore this tension. So at this point, I want to turn things over to Yona and, of course, thank him for his prodigious energy. Yona.
Thank you, Professor Don Wallace. Thank you again for hosting this event. As you indicated, the series that we began this year, focusing on this coronavirus threat. And as all of our colleagues know, thank you for continuing to support our academic programs for many, many years. As you indicated, we will plan to discuss specifically some of the interdisciplinary perspectives on the global COVID-19, specifically really on the economy, the business, the cost, the lessons, and the future outlook. What I would like to do is to introduce our distinguished panel. And again, in the interest of time, I will only introduce the individual speakers according to the order of the program. And I hope that you have a copy of the program in front of you. And again, I think I will only mention some of the highlights of the distinguished careers of our panelists. According to our program, the first speaker is Professor John Norton Moore, who is the director of the Center of National Security Law at the University of Virginia Law School. And as everyone knows, is a worldwide authority on international law and national security law and the law of the sea. According to my recollection, he was teaching the first course on national security law, and also I remember co-authored the first book, case book, in this field. And as many of you also know, he held many presidential appointments. I won't mention all of them, but I recall some, like the ambassador to the law of the sea. I recall his work and contribution on international law at the State Department, representing the United States in many international conferences on arms control, etc., etc. And also, I remember his contribution to the U.S. Institute of Peace, and many of the publications. We're delighted, John, that we could invite you to join us in this modest effort. John?
Don and Yoda, thank you so much, and thank you for putting on this very timely conference. As you know, I've been a longtime supporter of both of your superb work over the years. My remarks this afternoon will focus on two subjects. The first is dealing with future pandemic risk, and the second is a series of national economic opportunities during this time of economic disaster. Now, we don't normally think of pandemics as raising national security matters, unless they arise from some intentional use of bioweapons. But what we have seen in COVID-19 are consequences that are certainly the equivalent of many of the wars we've been in over the last 50 years. The level of human life lost already exceeds Vietnam and a number of other wars combined, and may well exceed Vietnam, Korea, and many, many others. The destruction to the economy has been much more severe than, at least in the short run, and as a consequence of many of the wars we've been in, not to mention so many of the other enormous disruptions to society that we're all experiencing today. Now, perhaps if pandemics occurred only every 100 years, as was the time period between the so-called Spanish flu in 1918, 1919, and the current COVID-19, maybe it would make sense that we just keep pandemics in a different category. But in the last 18 years, we have now seen three other COVID pandemics, SARS, MERS, and COVID-19, all in 18 years, leaving aside even Ebola, a non-coronavirus. We know that there are more than 25,000 coronaviruses on the national database. We know that increasing human interaction with animals, increase in population, a variety of other reasons are likely accelerating the greater likelihood of pandemics such as what we're experiencing with COVID-19. We're also seeing certainly that the appetite of terrorists have also been whetted very dramatically in terms of the potential use of bioterror as they see the enormous destructiveness taking place from the COVID-19. So I think we need for the future to be thinking about pandemics in national security terms. What that means is, just as we do in national security, we seek to deter, and then if we have to fight, we seek to prevail. And that means that we're prepared to keep a standing Army, Navy, Air Force, have very substantial expenditures, even though we hope it will not be needed as we seek to deter, etc. And I think what that means is be thinking of much more standing infrastructure and methods for dealing with viral pandemics when they occur. There's a second element in this, I think, as well, and that is we need to rebalance the way we've been thinking about healthcare. If we look at the last 10 or 15 years, we see that there has been a huge preoccupation with access to healthcare and how we provide reimbursement for healthcare. These are indeed very important critical issues for the country. But I think we have, because of perhaps too great a focus here in our healthcare budget, not had the adequate kind of focus we need on prevention and cure as well. If you look at the NIH budget from 2003 until present, inflation adjusted, it has gone down in terms of the research budget. If you look at the total workforce, public health workforce, over the last decade, it has actually declined. So I think we're going to have to be thinking as well in rebalancing what we think about and how we deal with healthcare to also add a much more substantial prevention and cure component. Now, I won't go into the substantial economic case for this, but economists have long understood that there are areas of basic research that are responding to what are called positive externalities that are a classic case for governmental support. And particularly in settings where you're facing huge cost, that the research budget, if it's able to deal with them, can be simply a tiny portion of trying to avoid such cost. It makes excellent sense. So concluding my first major point here, we need going forward what we might think of as a Manhattan, or I prefer the Apollo model, because I think we want a government-private sector partnership. It's not simply a secret effort in the deserts of New Mexico, but it is a government-private partnership, but a very major government-private partnership that needs to focus on looking at how we set up global viral monitoring systems, how we set up much improved techniques for detection of the viral outbreaks, the testing systems and the antibody systems on it much enhanced. We need to be looking at much more effective antiviral treatments in general in terms of a major effort to do that. We need to be looking at enhanced development and testing of vaccines, of how can we move the process along and develop techniques to make it much more effective and quicker than we're doing now. A lot of this, of course, is happening right now with COVID, but I think we need to follow it up, and when COVID is done, we are still going to, I think, be in need of focusing on this much more directly. And of course, it also means much more public health infrastructure spending, including appropriate clinical work and hospital efforts and support and protective gear for hospital workers. Now, this second point that I would like to make relates to, yes, we are in a terrible period at present. And it is an enormous economic disaster for us. We all know how important the economy is for a full range of national security issues, along with many other issues. But I think there may be a few opportunities here if the country actually could get its political act together in the ability to move forward. Most of what we've done, though fortunately the Fed and even our fiscal side, governmental side, and Congress and the President have acted very quickly, but it's primarily a relief program. We have not primarily basically had something that is a genuine fiscal stimulus kind of activities. And I would like to suggest three things that might be considered for that, but they all are based on one opportunity that's present in this time of disaster. That opportunity is the entire world seeks safety in buying United States Treasury bonds. We just issued, for the first time, I think, possibly in history, but certainly in recent years, 20-year bonds today. They were issued at an interest rate of 1.216. That is below the inflation rate. That's free money. The world wants to give free money to the United States government at present. Now, what could you do by issuing bonds, 20 to 50-year bonds, let's say, somewhere in that range? What could we do? First thing we could do is we could have a dramatic effort at dealing with physical infrastructure capital in the United States. Remember, it makes sense to borrow when what you're spending it on is going to return something greater than the cost of the borrowing. In this case, we could put it in things that really would dramatically increase efficiency and lead to productivity gains in the United States with much needed physical infrastructure capital. The second is human capital. We are in a setting with lots of people at home that can't go to work. We are beginning to understand the enormous potential for electronic teaching over the internet. And I think we should have a national program that basically is, again, a public sector, educational sector, governmental sector, that would basically have the private sector telling us what are the needed skills that we need today for hiring and for greater efficiency in the country. The educational sector then puts together those courses, and it is funded by the United States government out of these long-term bonds, basically with free access. And when you get the certificate of welding or whatever it may be, welding 1, welding 2, whatever it is in technology and all of it, those are going to be very serious things that give you an immediate opportunity to get a job in the area. The third of these is fixing the Social Security system. One of the things that we're doing right now and digging ourselves into a hole is the problem of Medicare, Medicaid, and Social Security and how we finally deal with it. Traditional ways of dealing with it have been to either cut benefits or raise the taxes on working people. But in fact, neither of those gets at the main problem with the Social Security system, which is it basically isn't an investment system. It is a system of a taxation that then gets sent back, maybe if you're lucky over the years, with a 1% return. It is terribly unfair to working people particularly. So what we need to do is to offer up what I call a Social Security optionality system, that all of those 40 and under would at this point have an opportunity to opt in to a completely owned private system like TIAA, CREF, and every university have. That means you own it totally. That means it can go to your heirs. And when we look at that, what we see is that it gives you the ability to have about $1 million estate for a 2 working income family. It addresses not only the Social Security problem, but it addresses the wealth gap more effectively than any other single thing you could do in the United States. It is the best low-hanging fruit, but we all know the level of unfortunate political kind of problems that we have in dealing with it. We can also offer, by the way, very easily a guarantee to those that make the change that their return will never be lower than the other return in the system. And if anything, what it does is make it easier to keep the rest of the system. There'll be no harm to anybody else that chooses not to be on it. So those are 3 things that might be done with the free money being given to the United States of America right now because of the enormous, sad disaster that we're all going through. Thank you.
Thank you very much, John, for your presentation. And I certainly like to mention that it triggered a lot of questions. We cannot actually ask you for an answer now because we want to continue with our other panelists who will have an opportunity. For example, what I was thinking about in terms of the issue of the conceptual understanding of what the coronavirus represents in terms of the concept of war, whether it is a non-explosive war or whether we should invent, if I may say, some new concepts from genocide maybe to coronacide or whatever it is, but we can discuss it later on. I would like to call our second panelist, if he arrived, Dr. Dov Zakheim. Is he there?
I certainly am.
Wonderful, wonderful. No, let me welcome you and just mention that the work that you have done for so many decades as former Undersecretary of Defense, as well as your work as an expert on defense strategy and program budgeting and the defense industrial, I think the Defense Industrial Corporation and naval operations, etc., etc. I think you work in government and also the private industry and working many academic institutions. I recall the work at CSIS, for example, the Atlantic Council, the Center for National Interest, etc. And your expertise originally in the Middle East, Europe, and Asia, and elsewhere. So again, we welcome you, and we would like to get your thinking about some of the economic perspective of this problem.
Well, thank you very much, Yona, and thank you, Don. And it's a pleasure to be on this panel. And I haven't seen my good friend John Norton Moore in quite a few years. We go back decades. What I wanted to do was focus not just on defense economics, which really means the budget, but to start off with some words about the impact of the virus on our readiness, what this might mean in terms of potential adversaries, and then talk about the budget as it fits within the larger budgetary context, economic context that we're going through right now. Let me begin with the Theodore Roosevelt. Everybody knows about the aircraft carrier with the whose captain sent out, Captain Brian Crozier sent out a note, didn't bother to pass it along to his immediate chain of command. It wound up in the San Francisco Chronicle. He was panicking about the coronavirus on his carrier. He got sacked. The acting secretary of the Navy got sacked. The story is almost over, but it's not over in a combat sense. One person has already died from the virus. There have been 14 relapses. The carrier is just about deploying now with only roughly 2/3 of its personnel aboard. It normally has about 5,000. It's got 3,000 people going out. It's been out of commission essentially for the better part of eight weeks. Now, what does that mean? It means that in a crisis, it may or may not have deployed. That is a troubling prospect. And it's not just that ship. There are 26 ships in the United States Navy have already been affected by the virus. And our allies are suffering as well. The most prominent case probably being the French aircraft carrier, Charles de Gaulle, which has at least 1,100 people with COVID-19 cases. So and other NATO states have been affected. So this really raises the question, in a crisis, who's going to be around? How do we deal with this? I must say, when I wrote something about this, a spokesman for NATO said, oh no, we're ready, we're doing things and so on. It's not clear that they really are. And that begs a major question in terms of what is our deterrent? How do we, you've heard John talk about the challenges of this virus. Well, how do we operate in an environment where we might get this virus back? We might get variants of the virus. It's not going to wait another 100 years, as John says. How do we think about these issues operationally? Major question needs to be answered. Another question is, how long will this particular virus last? Now, the Secretary of Defense, Mark Esper, has said he'll have a vaccine, or will have a vaccine, I should say, by the end of the year. But there's been a report of an internal DoD memo saying something quite different. That not only will there be a resurgence, or could there be a resurgence of the virus, which a lot of doctors, including Dr. Fauci, have said, but we won't have a vaccine, or we can't plan on one until the summer of 2021. Now, we know that a whole lot of countries, ours, the British, the Israelis, others, are working overtime to come up with a vaccine. But this is an internal DoD memo. They have to plan for the worst case, and the worst case is we're not going to get a vaccine for quite some time. So again, how do we deal with a potential action, say by the Chinese in the South China Sea, or in the East China Sea for that matter, or the Russians deciding that now is the time to march into Belarus once and for all and seriously threaten the Baltic states and Poland? What do we do? It's been a challenge even if we're at full tilt, but now we're not at full tilt. And if we think we are, we're fooling ourselves. So those, I think, are the immediate operational challenges we face. I don't doubt for a moment that the military will do whatever it needs to do, but the question is, what will it have at its disposal if things continue to spiral out of control because of a virus that we have yet to control? That, I think, is a major set of questions that we need to contemplate. Now, what about the economy and its impact on defense spending? First of all, before I even get to that, you should be aware that there is already a move on the part of the left wing of the Democratic Party to divert resources from the defense budget to fund fighting the coronavirus. Now, as it happens, we're already doing that. We have spent roughly $700 million out of the DoD budget for 4.5 million N95 respirator masks, for 13.5 million, give or take, medical and surgical masks, 95 million exam gloves, 2.5 million isolation and surgical gowns, 8,000 ventilators, both for HHS and DoD. We're already spending $700 million. Well, and that number is going to go up, which means we'll be spending as much on fighting or stockpiling for the COVID-19, I should say, as we're spending on aircraft, ships, tanks, and so on. That's just now. What about stockpiling for the future? That brings me back to these 30 or so Democratic congressmen who have written to the chairman and the ranking member of the House Armed Services Committee, that is to say, Chairman Adam Smith and ranking member Mac Thornberry, saying we should devote more money to fighting the virus. And there will be more to come. First of all, I don't expect that this desire to stockpile using DoD funds is going to end with 30 left-wing congressmen. I think you'll see more and more of them looking the same way. And the fact that so much money of the defense budget has been diverted to the very controversial wall with Mexico. I mean, the Secretary of Defense has just approved the transfer of nearly $550 million, it's $445 million for the wall, of which, by the way, 274 is coming from money that we were supposed to spend in Europe to deter the Russians. It's part of what's called the European Deterrence Initiative. And how that is going to affect the attitudes of our NATO allies, which aren't exactly great right now anyway, and they're coping with their own problems, is not at all clear. But what this does is give a lot of people cover for saying, well, if we can spend money on the wall, we can spend it on health, which is a lot less controversial. So we may see money coming out of whatever is voted for the defense budget to do other things that are not inherently defense oriented. But then how big will that defense budget be? Most analysts, myself included, believe that we're not going to see any growth at all. The question is, how big the decline? My own sense is we will see not only a decline in real dollar terms, we'll see a decline in nominal dollar terms. And the reason I say that is because we have just approved some $2 trillion worth of spending to fight the virus. The Democrats have proposed, in the House, have proposed a $3 trillion add-on. Most people think the Republicans will settle somewhere between 1 and 2 trillion over in the Senate side, or maybe that'll be the final outcome. So we'll be talking about $3 to $4 trillion over and above the current national debt. That is going to exert huge pressures on other elements of the budget. The only thing is, it's not going to come out of domestic spending. Not right now. It just won't. Defense will be the obvious target. So on top of operational questions, on top of money being diverted to other things, you're going to see huge pressures on the defense budget that will only complicate matters even more when we're talking about basically dealing with two major competitors, Russia and China. Now, there may be some offsets. One of my successors, Bob Hale, a good friend and a good analyst who was comptroller in the Obama administration, says we may save money on fuel. We spend $115 billion every year on fuel, and fuel prices seem to be down, and we might save money. Well, as long as they're down. Russia and Saudi Arabia have already reached an understanding that that's not going to be the case. They're going to work to raise oil prices. So how much we save there is not at all clear to me. But none of this is going to offset the major pressures on defense spending. And if you think our pressures are great, our NATO allies are going to face even greater pressures. To begin with, they haven't been spending so much on defense anyway. Now it's going to be virtually impossible, I believe, over the next few years for them to reach 2% of their defense spending. Now, whether the administration or a future administration starts beating up on the Europeans because of that, I don't know. But I don't think it would be a very good idea because they're pressed as well. Some of their, if they feel that the United States is walking away from them, they'll just move even more closely to China, which is ready to help them right now, by the way, is providing all sorts of masks and equipment and ventilators and so on, some of unclear value because it's not clear that they're particularly good products, but they seem to be saying we're here to help. We are not saying that. So that if we beat up on the NATO allies because they're not spending as much as we would have wanted on defense, they might just turn even more to China. So we'll be giving away even more to an adversary that doesn't give anything away to us. Therefore, my bottom line on all this is we need to be very, very apprehensive about where our defense budget is going to be. We need to think long and hard about how we optimize our defense posture. One issue, for example, is going to be, well, do we start really setting priorities? Can we stay in the Middle East? We have a president who really wants to get out of the Middle East. It's not clear to me that Biden will have any different attitude if he were president. And then there are other issues. I didn't even mention infrastructure, but both Trump and the Democrats agree more money has to be spent on infrastructure. Well, where's that going to come from? All in all, we need to think long and hard about our defense priorities, how we're going to posture ourselves, and how we prevent the defense budget from going into a real tailspin. I'll stop there.
Thank you again very much for your remarks, Dov, and obviously many of the issues that you touched on are going to be discussed by our colleagues on the program. The next one, for example, Guy Roberts, as you know, is the former Assistant Secretary of Defense for WMD policy, and He contributed to defense issues for many years as a government official. And they served also at NATO, as many of you know, and also had a military experience. He's a retired Marine colonel and all that. And on a personal note, I'm delighted that he joined us. He contributed a great deal to our academic work, all the way from serving also at CSIS and teaching and contributing to our publications. Guy, it's all yours.
Well, thank you, Yona. Thank you very much. And thank you, Don, for sponsoring this. It's great to see you again. I'm now relocated down to Florida, so that's why I'm kind of being casual here. It's another beautiful day. I should be by the pool, but I couldn't pass up the opportunity here to participate in that's very, very important event and look at a little bit at some of the issues. There's a lot of things I could talk about, but two things I really wanted to focus on, because I think there's a lot of misconceptions about one, and we don't pay enough attention about the other. One is, again, our preparedness and resilience in dealing with pandemics and epidemics. And John, I just say that, you know, the many years I've been working in this area, 30 years, I think I always felt that we're talking about a very critical national security concern with these pandemics and epidemics. And if you look at, you know, incidents like the 1918 Spanish flu and the impact that had, and all these other epidemics in the past, and we've had many of them, I think it's time to stop going to Congress when you're asking for money to say, you know, this is a low probability event, because it's not a low probability event anymore. And we've seen that in just the last 15 years or so. We've had several epidemics and pandemics, and this will continue. And the focus, you know, we focused on the COVID-19, but again, I'd like to look a little bit forward and talk about, you know, how we can take the lessons we've learned from this experience and go forward with trying to develop the processes by which we can respond to these kinds of events. Certainly there's no part in and the second aspect I want to speak to is the absolute critical need of developing what I would call the whole of society approach to dealing with these pandemics and epidemics, which of necessity requires us to look at and collaborate and coordinate with other countries around the world. You know, we, not unlike our Asian nations, and on one of my last trips was, Assistant Secretary was out to Vietnam, Indonesia, Philippines, Thailand. They, of course, many of these avian flu pandemics, epidemics started in that part of the world. They've had experiences with other diseases like Zika, and they've learned a lot of lessons that certainly we could take cognizance of. Also, Yona didn't say it, but I also was in the Bush administration, and President Bush laid out an agenda for dealing with pandemics in 2005, a document in which he made clear that we need to be prepared and ready to deal with these kinds of events. A lot of really great ideas were developed there. He asked for, I believe the total number was $7.1 billion to put in place all of the things that we felt were necessary in order to be prepared for dealing with these kinds of events. And there was a lot of enthusiasm for it initially, especially given the experience we had in 2001 with not just 9/11, but the anthrax attacks that we had that October as well. There was a lot of money that was made available. a lot of good things got started, but then they very quickly petered out, and we faced ourselves with the situation we found ourselves in today. The national stockpile, let's be very clear about that. There's no way we can ever prepare for or ever get the kinds of materials stockpiled that people think we should have. I'm a very much of a pessimist in that regard after my experiences of asking Congress for money and that not happening. You know, it's one of those things where we really have to do better, but frankly, we can't expect to have the national stockpile and others ready to respond to these massive type of events. It's maybe I would even call it a dirty secret. In the 30 years or so, I must have been involved in 20 or 30, 40 exercises where we exercise these kinds of events, and we all recognize that in mass casualty events we were not ready. We're not prepared. We do these small events, you know, a few hundred people, and we pat ourselves on the back and say, okay, we've done a great job here. We're ready. And yet, of course, when these things actually happen, we find out that we're not ready. How do you deal with events that are like this when you know that you don't have the resources to adequately deal with it? And again, I would just commend to you all to look at President Bush's 2005 warning, in which he talked about leaders at every level, both federal, state, and local, need to be prepared and available to do these things. And in the end, we're forced with doing the same thing we did in 1918, using a very blunt instrument, either, you know, shutdowns, quarantines, the same kind of tools again that were used way back in those days. There are many lessons to be learned in that. Recently, there's an independent and commission that was established to analyze and present lessons from epidemics and pandemics. They issued a report last January entitled Global Health Risk Framework for the Future. They concluded that the threat of pandemic diseases could originate anywhere and everywhere. It warned that despite all the advances of science and technology, the global community, quote, by massively underestimated the risks that pandemics present to human life and livelihoods. There are few risks facing mankind that threaten the loss of life on the scale of pandemics. As we have become more globalized with the movement of goods and people, and climate change that disrupts the environment, and as these pathogens move between humans and animals, we can certainly expect to see more, and it's quite possible that it'll be more frequent. As this panel also warned, I thought it was particularly relevant that, quote, further outbreaks of new, dormant, or even well-known diseases are a certainty. I mean, where did this particular virus come from, for example? Nations should recognize that, you know, these are not, they're no longer, if you will, distant, avoidable possibilities. They're a real, clear, and present national security danger. And we have to invest to be prepared, but the investments are more in the range of responses and processes, and not necessarily the ability to rapidly respond to these events early on. And that's another area that we need to do better at. It's time, certainly, to stop telling Congress and parliaments that pandemics are going to just be a low probability event. There's another area, too, that I'm very concerned about. And, you know, it's one of the things that, on one hand, we praise, so that is the many advances in science that give us the tools to fight these kinds of things. But those same technologies are also make the likelihood of these types of agents and pathogens being used for nefarious purposes and potentially for bioterrorist attacks that are very, very concerning, because these are could be man-made. We have a revolutionary new class of molecular tools that scientists can use to manipulate our DNA. This new technology is called Crispr systems. Crispr stands for clustered, regularly interspaced palindromic repeats. So it's a fast and easy and a very cheap method to manipulate the DNA of any organism, including humans. As a technology that is ubiquitous, it's available easily to all. High school students use it. But we have to wrestle with the possibility that CRISPR systems might be used to produce biological weapons of unfathomable destruction. And this could come, as I said, from nowhere and a very relatively short period of time. And this is another added concern because we're not talking about nation states. We're talking about an individual in his garage or a terrorist group that could use this technology in ways that would be harmful, far worse than what we're experiencing now. I would also recommend, again, those that want to get a very comprehensive approach to these issues is to look at the 2018 U.S. Biological Defense Strategy. It recognizes the necessity of working with multinational organizations, partner nations, private donors, and civil society as a whole to try to, first of all, rapidly respond to these outbreaks at their source and implement biodefense and security capabilities, policies, and standards. The problem, again, is, though, that we have had comprehensive documents and procedures and regulations and all of these other things that don't, over time, get implemented, or leadership ignores the importance of doing the kinds of things that are recommended in these documents with successive administrations, Bush, Obama, and Trump administrations have all put out guidance and urged leadership at all levels of government and the Congress to fund these things, and it hasn't happened. Let me speak a little bit about also what I think is very critical, I said earlier, and that is the need for a comprehensive multilateral approach. You know, this month we celebrate the 75th anniversary of the end of the war in Europe, and there we defeated the Nazi pandemic of their tyranny and genocide. And everybody acknowledged that that victory could not have been possible without allies working together. In fact, I think that's when Winston Churchill made his famous comment that there's only one thing worse than fighting with your allies, and that is fighting without them. We don't certainly do very well if we don't collaborate and coordinate and work together with nations around the globe and international institutions. Indeed, one of the most important, I think, lessons learned in this present pandemic is that the sooner world leaders recognize the need of this comprehensive approach, the faster we're going to be able to rein this in and defend ourselves against it. Given the worldwide availability of these biological materials, technologies, and expertise, obviously the potential for this infectious disease spread across borders and international approach then is crucial, that we can detect these things early on. When I was the Deputy Secretary General at NATO, we, again, in an effort to bring the allies together, we established and contribute to fighting these kinds of threats. We established a virtual stockpile that for countries to commit respirators, masks, vaccines, all of the things that are necessary to rapidly and effectively respond to these kinds of threats. Not a single European nation made any virtual contribution to the virtual stockpile. Not one single country. And when we went and tried to get them to do so, they just refused, saying, well, we have to deal with our own citizenry first, and we're not going to do something like that. And then I thought of the fact that when Italy just recently, of course, appealed for help to the EU's Emergency Response Coordination Center, no one came. It couldn't cajole or entice a single country into coming to Italy's aid. And the same thing happened to Spain and other hard-hit countries. They received little or no support initially from the EU. The 2016 Ebola outbreak, also in West Africa, demonstrated what would happen if countries have too few trained health professionals, too little equipment and supplies, and too little capacity. When I was in Vietnam last year, we talked about their biosurveillance network they've established in country, and the Vietnam wanted to take the lead regionally to create a regional biosurveillance network. And they were looking for support from the US. Several of the nations in the region also thought it was a good idea, but we've had some challenges in getting that off the ground. One of the ways in which we can have countries collaborate and cooperate is to combine resources. I had conversations, for example, with Cambodia and Laos about building a joint center in which they would contribute a proportionate share, and then that would be run by an independent contractor or organization, so that those resources could then present to the country that needed the most in a timely manner. That's the kind of thing that I was hoping that the United States would support. We haven't seen that yet, but I'm hoping that would come to pass when countries that lack the resources to have a full-blown biosurveillance and bioresponse capability. Let me end there. I hope I've given you some food for thought. I think it's critically important, again, that for these kinds of threats and these kinds of attacks, we have to respond in a collaborative, coordinated manner, not across the spectrum of U.S. government institutions, but also with our allies. Queen Elizabeth on VE Day said, never give up, and we won't, but we have to make sure that we have the tools to fight immediately and effectively and declare victory with our allies and partners. So thank you very much. Forward to our discussion.
Thank you very much, Guy, for your meaningful insights on many of the issues. And also we want to thank you for your contributions to some of our publications the past number of years. Some of the issues that you raised are going to be discussed by our colleagues. The next colleague is Dr. Daniel Gerstein, former acting undersecretary at the Department of Homeland Security, and as many of you know, is national security professional and technology experts of Dan Gerstein, and is very well known, as many of you know. He worked not only in senior government positions, but also in the uniform industry, academic work, think tanks, etc. And we're delighted to welcome him again. Last year, he spoke at the ILI on security and technology. And now we ask him to join us again and to deal with this interface between technology and the coronavirus. Dan?
Thanks, Iona. I appreciate the introduction. Thanks for the kind words. Well, I'm going to go a little bit different than what I normally do. I'm not going to talk that much about Department of Homeland Security. I am going to talk about COVID and the economy. And I think there's just a lot to talk about here. Here's what I want to do. I want to give you 5 principles for thinking about COVID-19 and the economy and what we're facing. And then I want to leave you with what I'm calling winners, losers, and it's still too early to make an assessment of where we are with respect to sectors of the economy and technologies that have either come to the fore or moved to the rear. So let me start at the beginning by talking about a little bit about COVID and the economy and saying it's very difficult to separate the health response from the economy. Much of what we think about really has to be put within that lens. And I hate to say that I feel like we are almost at the end of the beginning. That is, we're not even at the end of the beginning yet. We're almost there for this global pandemic. We still have much to learn about the virus. In fact, it was just yesterday that we think we've discovered that having COVID one time likely leaves you with immunity, which is actually very good news. And that could be helpful in helping us restart the economy. But the bad news here is that we are still seeing an exponential growth in COVID cases. While that growth has slowed a bit here in the United States, there are other nations and regions around the world that are just now beginning to experience COVID-19. And I would also say that we still do not understand how to live with this virus. And that's going to be very important. We still have people who don't understand the seriousness of the virus, which is problematic because some are not following proper guidance. So with that said, where are we on unemployment? Well, we're about at 15% unemployment. The experts say we're likely to get to 20% unemployment. The unemployment is probably a little higher than what we're giving it credit for, just because of the way things are counted and who's filing for unemployment and such. As we begin to reopen and put our economy back on track, we should be very likely to experience the continued spread and economic starts and stops. And depending on how we do, that is going to be extremely disruptive for our economy. In fact, what the experts say, the economic experts would say, is that that could even be worse than having these very draconian measures for social distancing, isolation, et cetera, in place for a longer period of time. So it will be something to watch. The length and the strength of the recovery also remains very uncertain, and that is absolutely essential. And it actually figures in closely to how I thought about picking the winners and losers and the too soon to tell. The longer this goes on, the more we are likely to see some businesses, some sectors not ever fully recover. I mean, that's really something to think about. Now, when we look at this, we'd have to say that when we look at our actions, we have been approximately, as a nation, 2 to 4 weeks late on most of the key decisions that had to be made. And that has actually come at a very significant cost. And so we're seeing that play out now. I say that because we were not able to, through biosurveillance, see the virus here in the United States. And because we could not see the virus here, we weren't able to sense that it was here. We missed the early stages of the virus and had to go right to containment and the social isolation. In fact, we were not able to do the sorts of contact tracing that you would do if the virus was only in small pockets, because by the time we were able to realize we were already inundated in many locations. I would also say that things such as the uncertainty and misinformation have also been absolutely devastating to the economy. It created volatility in stock markets early on. It creates confusion with the people that has been very difficult to manage, and it has caused these, some people not staying in the social distancing, which means that they have allowed the virus to continue to spread through that cheating, if you will, on the social distancing. And we've also seen a very unproductive discussion with respect to science versus politics. And I'm not going to get into any more of that here, but I just think it's something to acknowledge. We watch other nations around the world, and those nations that have done best took early actions. They had competent testing. They were aggressive with their testing. Of course, what happened with us with the CDC test has already been vented here, vented in other forms, as well as I mentioned it the last time I was on. But, in short, we also failed to learn from the experiences of other nations. Now, my third principle is that there are many people who are calling for a global decoupling. And by decoupling, they're talking about going to sort of, if you will, almost a Cold War where we would decouple the economy, particularly the US and the Chinese economies, that we would go to measures where we would do most of our own internal manufacturing for items and such. And, it's very attractive to say those things. But I would remind the audience that we have been driven by market forces, and we didn't arrive at this situation in a haphazard fashion. We did it because we have a market economy, it's a capitalist economy, and that means that the objective function, the goal, if you will, is to do things in a cost-efficient manner. And so I'm not arguing that we shouldn't try to decouple in some areas or certainly become more self-sufficient. But what I would argue is that we have to think about what the implications are longer term, because we did arrive here through gaining competitive advantage in certain technologies and letting the market forces work. I would also say that in terms of this decoupling, the US has actually benefited greatly from the economic system we've had. And in fact, it was only over the last 100 years that the US became the largest market, the largest economy in the world. As a reminder, actually China and India were larger than the United States before about 1900. And so the last 100 years or so have actually been an anomaly. And so how did we get here? How did we get in this market economy that propelled us to this great wealth? Well, it happened at the end of the second industrial revolution, which ended about 1870. The US was left with many technologies, much manufacturing capacity, much capability. And so that helped to propel us into prevailing in 2 world wars. It helped us to, coming out of World War II, have help get the United Nations stood up, the Bretton Woods Agreement. All of those things were in our interest. And so as we think about decoupling, I would just remind a group that we also need to think about what China is designing. China is actually has been thinking about a somewhat decoupling. They have their Belt and Road Initiative, in which if they were to cause that to come to fruition, would have 2/3 of the peoples of the world falling under China in terms of economic capacity. And Made in China 2025 means to challenge the United States in all key technologies that are emerging. Now, China's made some mistakes on this virus. They look like they're going to be letting us come in the future and look at that lab in Wuhan to be able to understand what went on. But, we need to think very carefully about how we deal with China in the future, because losing access to the second largest economy, the second largest market, if you will, could have dire impacts long term. I would also say on international that our current fight with the World Health Organization is extremely unproductive. We need to try to stay close with the World Health Organization, make sure that they're running proper investigations, that they are helping those developing countries that are going to be facing this COVID-19 either now or in the very near future. So my fourth principle is, what's the government's role in a market-driven economy? So today we see we're doing stimulus funding. We still need the government to develop the budgets, and we need to think about servicing the debt. And these are going to be absolutely key for the long-term viability of the US economy. So what are some of the areas? Basic and applied research, research and development. We also need government to be continuously and continuing to incentivize industry. We also need to have regulating of industries. One need only look at some of the testing issues associated. We have over 100 tests that are out there, and many of them have not been regulated by the FDA and are inaccurate, do not work, give false positives, false negatives. So I said that I would talk about economic winners and losers. And as I get into this, let me say that we are going to consider this time in human history, at least in the foreseeable future, as the pre and post COVID periods. And the longer this crisis lasts, the greater the effect we'll have to work through, and the more it will speed technology adoption in the future. So what are the winners and losers? And I think I'll start first with the winners, and I'll sort of quickly go through those. The first winner, which will have gained momentum during the pandemic, clearly I picked out three categories: communications, science, and enhanced services. So communications, anything telework is a winner. We heard it by one other of the speakers today, but anything that deals with anything, work, medicine, education. Social media and smartphones, I think here too, our communications architecture is going to be very important, as will our terminal devices. Assured broadband communications will be absolutely essential to our society going forward. It'll be essential not just to get through this crisis, but to maintain competitiveness. Science, research and development is key. Biotechnology and novel agriculture. Look to the future to think, will we still be having traditional farming the way we think about it? There are much more efficient, less costly ways to do our agriculture and satisfy our demands. Artificial intelligence and robotics, we've already seen the use of some of these capabilities in this COVID-19, and they've played an important role in starting to play an important role in the vaccine development. In terms of enhanced services, I would say public health and everything surrounding public health and how we think about public health. And another one, the final one on enhanced services, is supply chains that no longer necessarily land at stores, but land right at our front doorsteps. So what are the too soon to tell? Well, I'd say some of these might be a bit counterintuitive to what I just said, but large scale gatherings, education, we're not sure what higher education looks like. We're not sure what K through 12 looks like. And there's a lot of work to go on to figure that out, even if it's just in the near term. Sports and concerts, big money makers, very difficult to conceive of how that comes back anytime soon. Institutions, what is the role of the federal, state, local, tribal, territorial? The federal government in this particular crisis has failed the states. We have failed the states at the federal level. And that is going to have to be discussed later on. What about global collaboration on transnational institutions and national issues? In terms of spending, it's still too soon to tell, but Doug Zakheim talked about this. The defense budget, also traditional agriculture, cybersecurity, interestingly. You know, we talk about getting the message through and being able to communicate, but we've not been talking nearly as much about cybersecurity. And we're putting a lot of platforms out there before they are necessarily secured to the level they should be. Also, economic self-sufficiency spending. Are we going to be willing to actually spend to have a stockpile that's fully equipped? And then another too soon to tell is health and medicine. What are we going to do with healthcare? We finally are going to have to tackle this. It's right at our doorstep. And also things like immigration. Too soon to tell where we will wind up here. And the losers, and some of these may not come back. Long recovery, if at all. Tourism and travel, transportation systems in general, cruise line industry and airlines, they will have to rethink their business models. And then service industries. We've done away or done along without brick and mortar for quite some time now. We've shown that we can do it. How many of those actually come back, and what do their business models look like? Restaurants. I predict as we go forward in this period of reopening, restaurants are going to be a very difficult source of continuous infections because of the close environment and the recirculating air. And then, frankly, I think we're going to see a more, if you will, energy toward technological pushes toward getting rid of lower wage and lower skilled workers in the workforce. And so it's going to accelerate, if you will, a workerless or at least a worker-less society. So with that, I will stop and I look forward to the discussion.
Thank you very much, Dan, for your insights. You gave us a lot of ideas to continue our work in the coming months. And obviously, I think we would have to focus again on understanding how technology evolves and will be essential for the United States to continue to maintain its global leadership, and you dealt with some of these issues in your latest book. So we're going to move on with the members of our program. I would like to invite Ambassador Bob Hunter. Is he there? Robert Hunter?
I can see me. Can you see me?
Yes. How are you? Wonderful.
I am well, thank you.
Thank you very kindly. We would like to welcome you again to join us. We would thank you for your contribution to our work in the past. As many of you know, Bob Hunter is a former ambassador to NATO, and he represented the United States at the EU and so forth. I recall our work at CSIS so many years ago on Europe and the Middle East issues. We appreciate very much your prolific contributions to our work in the past. It's all yours, Bob.
Well, thank you, and I'm glad that John Norton Moore just got back from the Johns to hear what I have to say. I would first off saying that a couple things about what I've heard so far is first, everybody's focused on the future. There's not a lot of blame game going on, which is what is we're all focused on. For example, if I look over my left shoulder here, I've got CNN on, and it is 100% Trump is the bad guy. If I clicked one channel and I got Fox, it'd be 100% Trump is a good guy. They can't both be right, or maybe they're both wrong. We face a particular problem this year, unlike what happened after Pearl Harbor, what happened after 9/11, in which the presidents then in charge did not have to face re-election for 3 years. And as a result, it was possible, even though there were midterms coming up within a year or so, it was possible for people to think about it in terms of the national interest rather than how do I maximize this. I will make a very bad prediction right now, a dire prediction. I don't think anything's fundamentally going to change in what we do until November the 4th, because there's just too much at stake on the part of Trump, the Biden people, people in the Senate, Mitch McConnell, all the people like that, to do anything between now and then. That's a terrible statement. I would also say that listening to what I've heard so far, if this group of people were put in charge, we could probably solve a lot of the problems right away, but none of you are in charge. And none of you are going to be put in charge, certainly not before November 4th. I've also heard a lot of very good ideas of what needs to be done. Dov and I may have some difference of view with regard to the defense budget. I think it's bloated. I think it's been a lot of misallocations that we have failed, I think, since the end of the Cold War to do what I think we needed to do, which is to switch over a calculation, it's already come up before, to a national security approach rather than defense or something else approach. The integration of all instruments of power and influence and some of the trade-offs. One of the reasons we're in such trouble now is we haven't focused on things like the American healthcare system. I like to believe that one thing that will, but I can't prove it, that will come out of this, people will finally say, we can still debate how, but let's stop debating whether and what we have to do on funding our national health care. Among other things, I think there is a moral responsibility. What's his name? Tom Brokaw once talked about the greatest generation, the people who served in World War II. I think, quite frankly, we're seeing an even greater generation today in the doctors, the nurses, the people who deliver the food, the people who work for Amazon, the postmen, all of these things, many of whom, a large fraction of whom, are from minority groups and who are running the greatest risks. And I think we owe them a real debt in terms of their being able to have a chance to make a decent living, and also in particular, to begin with, in terms of healthcare. Are we going to do it? Quite frankly, I doubt we're going to do it. I think that when we get back, if and when we get back to a time that one would call normal, the people who want to be the winners are going to come out of the woodwork right again. Some are already doing it and saying that's fine. We want to keep our piece of the pie just as much as we had it before, and if not greater. And let's not look at what needs to be done for the people that are left out. And one of the things that's already happening now is that there are risk analysis going on. How much risk do I face that I'm going to contract this thing? And if I do contract it, what are the risks I'm going to die? And people are voting with their feet. Already, it is clear that most of the people who are getting it are coming from urban environments, where New York City, which has the greatest concentration, plus the greatest concentration of minority groups, whether they're blacks or Hispanics or undocumented immigrants, whatever they are, and also some of the other great conurbations, and also the greatest concentration of deaths. We see Governor Cuomo on television every day saying all the wonderful things he's doing for New York State, but the real problems in New York are less upstate, they're in New York City. The person who's doing the real work is not Governor Cuomo, it's Mayor de Blasio, but everybody hates him for a number of reasons, and he's not very articulate. And that's where the deaths are. 2/3 of the deaths in New York State, or 3/4, are in New York City. Okay, so the risk analysis, people are saying, okay, if I'm under 25, the chances, even if I get it, of dying are minuscule. I mean, it may be under 1,000, I have no idea, but certainly very low. People under 45, it is still very low. People who are in my generation, and everybody else here is probably a good deal younger than I am, I'm giving you all that credit on that. Our chances of dying are very high if we get it. And whether, in particular, if you have, quote, underlying conditions, and being older is an underlying condition. So there is this risk analysis going on, saying, why do I need to do all this stuff? Because even if I do get it, I'm not going to die, right? And people are voting with their feet. Now that may mean later on the numbers are going to go up, but they'll probably go up again in what I call the greatest generation. I'm talking about the ones who are actually participating, not the ones who are just passive and are dying anywhere. Which means that the political impetus for making things different is not going to be there. We have to remember that in the two great movements that are marked by the New Deal and by the Great Society happened because of the impetus out of the middle class. In the Great Depression, because the middle class were out of a job. During the Great Societies, because the middle class was essentially doing well. And a lot of the race relations had to do with that. The irony of that is that race relations in the late 1960s came more or less to an end because Martin Luther King and others correctly understood that people in Black Americans were dying at a greater percentage than were white Americans. And then in the white middle class, scared to death of the draft for their kids, because that was before Nixon wisely stopped the draft in order to make the protests go down, which they did, were worried about their kids going off to Vietnam, getting kids, so they forgot about the blacks. All right, we're now in a circumstance where I fear when we come out of this, assuming we do, the great middle class is going to say, I'm going to have to worry about my jobs. I'm going to have to worry about what is going to be, as we just heard from the last speaker, a massive restructuring of the middle of the U.S. economy. Massive restructuring, because there are certain areas that people, they will just not be resuscitated, of which restaurants are only one, but there are a whole series of others which relate to lots of people being together. I wonder what's going to happen in sports when whether we're ever going to have people at 100,000 at an Ohio State football game again. These all have impacts. I look at the infrastructure. We did not do after 2008 the kinds of things we needed to do in fundamental infrastructure. Everybody in Congress, beginning with the Democrats, all had their pet little projects, and we frittered away how many trillions of dollars. My test case, and all of you who live in Washington can check me on this, is when we are going to have the underground, metro, getting us to Dulles. We've been working on it for 8 years now, and it's still going to be at least another year before that's completed. I have joked for a couple of years, if we subcontract that to the Chinese, they would have it done in 2 months. But if we can't do that, and if we can't get a decent railroad between Washington and New York, and if we can't put more into railroad rather than into other things, we have the car industry, which is worried about self-driving cars rather than getting into more into the electric kind of thing. It's just where the incentives are. The structure of our current form of capitalism doesn't have the incentives on that. Incidentally, I should have started off by saying another thing. As I said right at the beginning of this, the current pandemic, is a dry run for something much, much worse, which is climate change. Some people out there already think it's too late, but unless we find a way to move radically, not just away from fossil fuels, but into the one alternative that can work, which is electricity. But where will the electricity come from? It won't come from solar. It won't come from wind or thermal or tidal. It just won't happen. The science says it can't happen. You could pave the entire world over with solar and you wouldn't make enough thing. The only answer, I'm not getting in trouble by saying this, unless you get fusion, is nuclear power. It's the only one. The science says that. Financial Times had a long piece the other day about it. They didn't even mention it, okay? But we can't say that because we had 3 Mile Island, et cetera. Now, what we need to do before we get any of these wonderful things done is to do something about our politics. We have a dysfunctional politics. It wasn't working particularly well under the last couple of administrations. It's not working well now. And I don't have great confidence that if Biden were to win, we would have a movement away. I'm not in great confidence that if the Democrats win in the Senate, and as a Democrat, and I happen to think these are necessary but not sufficient conditions, if I thought that Mr. Trump the day after the election would pivot on a dime and start doing some of the things that you people have been arguing for, including what Dalva's been arguing for, then I would say, okay, fine, maybe it doesn't matter so much. I don't think he'll do it. And I don't think he's prepared to hire the people who will do it. If Mr. Mitch McConnell is returned, I don't think he'll do it. I'd be perfectly happy to see the Republicans maintain the Senate if they would restructure the way they do it. So I guess that's my kind of thing. Oh, incidentally, here comes another third rail issue. If we're going to pay for these things, not just by borrowing, and I'm one of those people who doesn't worry too much about borrowing as long as we have a productive economy. And obviously the rest of the world sees it the same way because they continue to buy treasuries. They don't have to buy treasuries, but they do. Taxes are going to have to go up, and particularly taxes on the rich. That starts with getting rid of the last tax thing, whether you have a wealth tax or not, I don't know, but it's not going to happen. You can't get people to talk about raising taxes. Read my lips, no new taxes. And the guy who said that got defeated in the next election, if you recall correctly. But that's what I would say has to happen. So we got to do something, if we're going to do all these things, fundamentally about how we look at the way we do our politics. Whether it's Republicans or Democrats in charge is less important than the way our leadership are prepared to look at these things. The idea of international cooperation, that's a no-brainer, absolute no-brainer. One other thing about, and then I'll shut up, about the American strength in the world. One reason people look to us is not just because we have a strong military, that's part of it, but because they've been able to rely upon the United States to get things right in our own economy. Okay, if healthcare doesn't work so much and we have paid a price for the future by letting Betsy DeVos ruin our public schools even more than was being done before, and okay, if that's in the future. But people invest in this country and rely upon us because they have confidence we're going to make our economy work. And I think we are having that drift away. And if we don't start paying attention to that, then I think maybe we will lose the struggle with other countries, of which the number one requirement, of course, is to have the dollar remain as reserve currency. And we're able to pay our bills in the world by just printing money. We're the only country like that since the sterling thing went down. So this is where we got to start. Now, are we going to do that in that country? We have to. Are we going to do it? Unless these people on my screen are put in very senior positions and we get our politics right, I am very doubtful we are going to do the right things.
Okay.
End of Jeremiah.
Well, thank you very much. Obviously, our colleagues can join soon to respond to some of the issues. This would keep us busy for the next decade, but I want to move on to our commentators. We're very fortunate that we have a number of people who participated in our ambassadors' forums on the coronavirus in the past couple of months. And we would like to invite them to join us. Now, the first one is Dr. Rita Caldwell. As you know, she is a distinguished university professor at the University of Maryland, College Park, and the Johns Hopkins University Bloomberg School of Public Health. As you know, she was the director of the National Science Foundation and many other organizations. And also she was awarded many honorary degrees from many institutions of higher learning all over the world. And we're delighted.
Okay, well, this has been, gentlemen, this has been fascinating discussion. It's a really good couple of hours, and I thank you. Let me pick up on some of the comments. First of all, as an evolutionary biologist, I'm a microbiologist. It's absolutely true that we're going to have another COVID. Let's just look at the timeline. The plague in the 1400s, the 1918 flu, and notice how it gets shorter and shorter. Then we had just the ordinary flu, where the flu was very, very serious, the influenza, but it became domesticated, and so now it's with us permanently. And then we had SARS, and then MERS, and now we have COVID-19, and we're going to have COVID-20 and COVID-21, 22. They're going to be novel viruses to which we've never been exposed, and we're going to go through this hell all over again if we don't do the things that you've all been recommending. Dealing with a public health service, building it. And I'd like to pick up on the very, very insightful comment about the defense budget. In fact, I think one way to protect the defense budget is, in fact, to treat the, to address the public health as not just part of the defense budget, but as part of, let's say, boosting the Center for Disease Control, but considering it as part of defense so that we leave alone the $750 million that was used to buy masks and the $400 million that was used for building the wall, but instead consider the Centers for Disease Control as part of the national defense, the NIH and the CDC. And so that boosting that budget and leaving the defense budget where it is, at least that would be better than getting it cut, which I think was the suggestion. But let me tell you what we really have got ahead of us, and that's what I call the trifecta of the apocalypse. Population increase. That's the elephant in the room, and nobody has mentioned it. It's a very difficult subject to talk about. It's worse than politics, which you discussed it pretty well in the last talk. But we're now at 7 or 8 billion. We're going to 10 billion. And then we have climate change, which is reducing the food supply, increasing infections, and the release of new COVIDs. And then the pandemics, the population, and climate change. There you've got what I call the trifecta of the apocalypse. And I think that if we don't address the population and climate change along with dealing with the epidemics and pandemics that we face now, and indeed the comments that were made that this COVID-19 is not going away because we did not do what we had to do in January, February, and March. So all we can do now is sort of like the little boy in the dike putting his thumb in to prevent cascade of the walls, is all we can do now is suppress the curve until we build our herd immunity. And then we now have to deal with COVID-19 as we have dealt with the influenza that we have on a regular basis. And then if we don't do anything about our public health system, we're going to have coming very rapidly, maybe in the next 20 years, the COVID-21, to which we are completely naive, completely unprepared, and go through this whole horror all over again, but it'll be worse because we'll have 3 billion more people. So I think we really, I am attuned to the suggestion that, yeah, we do need a change, and Trump is not going to do what we need to do. He's going to keep doing what he does because that's what he is. He's not going to change. And so if we do have a change in the federal government, or if we have no change in the top, but we do have a change in the Senate, then at least we might be able to institute some of the changes. And I'm not going to repeat the wisdom that has been expressed, except to say I agree with you guys. Maybe it's because we're all the same age, I don't know, but and we're wise from experience and having burned tails, so to speak. But I think there's an agenda that you've laid out that we really, I think if Yona can get them captured in the notes, we might use it as a manifesto or some sort of a message to those who are listening. So those are my comments, and it's been a great discussion.
Thank you very much, Rita, and for your leadership in this field for many, many years. We want to move on to Dr. Richard West, who is orthopedic surgeon and also sports medicine specialist. He participated in many of these activities, the sports Olympics area, and he participated, as I mentioned before, in our previous sessions on this issue. Ricky?
Yeah. Well, thank you very much for inviting me again for this seminar. I do have some PowerPoint slides. If you could bring them up, Gergen, please. Thank you. And then I have a few comments at the end about lessons learned from my own experience, which again probably has something to do with age as well. So first slide, next slide, please. March 1, 2020 is business as usual. Next slide. March 12th, 2020, next slide, was the day that the sports world stopped. Next slide. So we have millions of kids staying at home as sports go dark and schools closed. Next slide. And if you remember the old Casey at the bat, there's no joy in Mudville anymore. Next slide. So the public was in distress. Was this really just science fiction? Was this real? What are we going to do without sports? We can't play, we can't attend, we can't watch. And the sports section of the newspaper had nothing to offer. Next slide. So in essence, we have many questions. When can we play again? Will it ever be the same? When can I stay in business if I'm a sports organizer? And will families, children, colleges, professional sports be able to afford sports again? However, these answers are to be determined. The reality is we just don't know the answers. Next slide. The goal, regardless of whatever we do to return back to some degree of normalcy, is really to decrease the transmission of the virus. And these decisions should not be made or should not be driven strictly by the economy or by economy. We need to be cautious because of the implications of COVID-19. We know that there are long-term effects health-wise, both cardiac, pulmonary. So it's not simply just, well, you can overcome the disease and now you're good for life. The only way that we can protect ourselves later is not to get it. Next slide. So currently the CDC has issued guidelines about no organized sports or activities, but also in the CDC recommendations, there's also the recommendations for children between the ages of 6 and 17 to get at least 60 minutes of activity per day, which used to be partly in schools, partly after schools, and that clearly has been diminished. So we now have to look that we have to be optimistic that the current situation is going to improve, and there will in fact be a phased approach to return to, we'll say the word normal, but we don't really know what that really means. Next slide. So what are the metrics for phased return to sports? I know we've been talking about security issues and global war, etc. But this is very important in terms of the national psyche, our culture, how we get people to just get back on their feet and also to be productive members of our society. So we've determined that really these decisions are basically local decisions based upon public health, logistics, and operational capabilities. For example, in Montgomery County, Maryland, or in the state of Maryland, the decisions for phased return to activities is a county by county decision. In some states, like in Massachusetts, it's a town by town, and in other municipalities or in other states, it's a state by state. But basically, from a phase to phase advancement, it's based upon having a decrease in the number of COVID-19 cases, the ability of increased COVID-19 testing, that the number of positive COVID-19 individuals is decreasing, and we have the ability to do contact tracing in place. Next slide. So from the standpoint of organized sports, we have organizations such as USA Soccer who've now started to make rules adaptations to start getting the process of getting people back, kids back to play. For example, they've eliminated heading for kids 11 years and younger. Next slide. But some of these things we don't have answers for. In other words, the adaptability of rules. How will personal contact be dealt with? Next slide. How will social distancing work in a sport like baseball? When you see this, you have 3 individuals. 1 player on one team, batting, 1 player on another team, the catcher, and also the umpire, all within a very small area. We have issues with officials. In youth sports, most officials, the demographics of the officials are that they're all, for the most part, 60 years and older. So they become at a higher risk age for potentially getting ill. Next slide. We have to consider change of behavior, the dog piles. Next slide. The high fives, the wrist slapping, the chest bumping. This is something that's not going to be easy to suddenly create new habits for those individuals who've been doing things ever since they were young kids. Next slide. We also have the question about what happens to, what's the future of larger events? You know, will social distancing really work, or will it even be accepted? Again, I don't have the answers, but I pose these as questions which are going to be very significant. Next slide. So there's also in the realm of professional and international sports, as you see a little bit of the publicity, what are their challenges? The challenges of travel, the challenges of public transportation, the challenges of housing the athletes as they prepare for participation in a sport. Next slide. But from the standpoint of young children, the youth sports, okay? So who pays the bills? Now we're talking about the economics of sports on a local level. We're not talking about the National Football League. So local sports are supported by local restaurants, local businesses, parents, fees, all of whom are those individuals who are in some degree of financial distress at this time. Local sports, they don't have beverage companies, sponsors, there are no broadcast companies. And this is part of the challenge. In addition, those sports such as soccer and baseball, where there are travel teams, this is part of the allure for the businesses of the organizers to bring kids into the fray because of their being promised these additional experiences. Well, that's no longer going to happen, at least for quite a distance. And recently, the fear of the parents of their kids returning to sports. A recent Hopkins study showed that 50% of parents polled in this large survey were fearful that their children were going to get sick when they returned to sports. And 46% of those parents were afraid that they were going to get sick from their kids. Next slide. There's also the challenges of colleges. We have just the students themselves going back to school. We have dormitory living. I mean, dormitory living is no different than a cruise ship, where you have close confinement. The dormitory space is not conducive to social distancing. What about college sports? Well, this is kind of an interesting illogical argument. I mean, some of the colleges are saying, well, it's okay for the athletes to go back, but it's not safe for the students. Well, that doesn't make any sense. How can it be safe for the athletes and not for the students, or vice versa? Next slide. So we know that there's, benefits for sports, but we also have to accept that parents are going to have to make decisions about what is minimally acceptable as far as a risk going back to sports. Next slide. This is an interesting quote that I saw, that a parent in St. Louis said that we've taken all this time and effort to stay at home for weeks to control this outbreak. It seems silly to let my kid play a baseball game. Why take that one risk? It can all backfire with one stupid mistake. Next slide. So we have this big issue now of what the parents and their expectations for kids returning to sports and activities. So next slide. We're going to see, I think, and right now, of course, because of the lack of organizational and of sports, is that free play and pickup sports are going to really challenge the organized sports, and it's going to force the organized sports to become a little bit more inventive of how they create their issues. Next slide. Now, the economics of sports at the grassroots level, which is what I'm referring to, really depends upon participation. So businesses don't stay in business if they have no participants. And if the participants don't want, and if the parents who are the stewards of the participants are fearful of their kids going back to play, then the businesses are going to fail. Next slide. So there's another Hopkins study that suggested that 50% of all youth sports organizations are at risk of shutting down. That's rather significant. Next slide. And at the 2008 recession, team sports participation dropped significantly from 45% to 38%. And in 2014, according to the Aspen Sports Institute, those levels prior to the recession have never returned. Next slide. So this also, from a social standpoint, this crisis may widen the gap between those who can afford to pay for sports versus those kids who cannot. Next slide. Just as an aside, we also have the professional sports models. I mean, the National Football League, the Major League Baseball, the National Basketball Association, and the National Hockey League, they have a tremendous amount of revenue, but that's based upon not just people going to a stadium and buying tickets, because most of the revenue is coming from television, and it's based upon people watching, which may have a boon for a while, but it's unclear. Next slide. Actually, 2 slides, please. So in order for, will sports be fun again? Actually, you can go to that last slide. Will sports be fun again? Or will they lose their appeal, and therefore the economics of the sports will be severely affected? So again, I raise questions. I don't have the answers, and I don't know that anybody really has the answers. That's the end of my little presentation, but I do have just a couple of comments based upon the speakers, if I may. I was impressed with Ambassador Moore. One of the things that, as a doctor in the field, working in different settings, it's always been an interesting caveat that in many situations, doctors are not considered to be important until they're needed. And the way that you've portrayed, you know, now that there's a little bit of a different look towards those people on the front lines is very gratifying. From some of the lessons learned, I was in medical school during the Vietnam War. And we knew that if we didn't go into the public health service and we didn't have a specific deferment, we were going to get drafted and go to Vietnam. So at that time, we also knew that the public health service, specifically the NIH, and which was a little bit more advanced at the time than the CDC, took the cream of the crop of those graduates of American medical schools. And it would seem like, as part of a national strategy today for national service, that this would be a way of re-energizing the healthcare system through the CDC and the NIH by attracting and incentivizing those graduates of American medical schools to go into public service for a time where clearly this is going to be part of the great strategy moving forward. The other lesson that is also to be learned, and again, I'm old enough that I was part of the Salk vaccine trials. And that was a world, I guess it was a pandemic at the time, the epidemic of polio, where we were fortunate enough in the United States to be part of the Salk vaccine trials. And I knew other people in other parts of the world who I've met as an adult who were the same age as I, and they developed polio and we didn't. So I can still see the lines in our kindergarten and first grade rolling up our sleeves and getting the injections, and then the Sabin vaccine after that. And that's a lesson that it worked. I mean, polio is you know, when I was in residency, the iron lungs were part of museum pieces. They weren't part of medical care. I'll stop there. Thank you.
Thank you very much, Ricky, for your insights. We have to move on to Ambassador Charlie Ray, former U.S. Ambassador to Cambodia and Zimbabwe. And also he was a Deputy Assistant Secretary of Defense for POW, missing personnel at the Pentagon. Charlie?
Thank you, Yona. I am in awe at being included in this august assembly of people. I'd like to start off by making what is probably a stupidly obvious statement, and that is that this COVID-19 pandemic is far from over. In fact, and it's been mentioned here, there are experts who are predicting it could be with us for as long as 2 years. The Spanish flu was mentioned, and you know, the Spanish flu of 1918, which by the way did not originate in Spain, but is likely to have originated at a training base at Fort Riley, Kansas, among soldiers who were training for deployment to Europe, ravaged the globe from January 1918 to December 1920. It killed 20 to 50 million people, including nearly 700,000 Americans. Spanish flu disrupted social life, and the economy was left in disarray with massive unemployment and business failures. In this pandemic, we're seeing a lot of the same, and it could get worse. Personally, I think that the road to recovery from this will be a long and hard one, and there's no amount of protesting, posturing, or complaining that's going to make it go any faster or any easier. It's going to be a real challenge, and it's going to be made all the more difficult, I think, by a tendency I've noticed of people in the face of crises like these to circle the wagons and to draw into shells of isolation. There are few people, including those of us of our age group in this symposium today, who remember the privations that were endured or the sacrifices made during the 4 years of World War II. I happened to be born right at the end of that conflict and grew up listening to stories from my mother and others about the blackouts and food shortages, shortages not only of luxuries like silk stockings, but of just basic consumer goods. And I don't think we remember that it wasn't isolationism, but international cooperation that enabled us to come out of that terrible time and build a world economy that was even stronger at the end than it was before the war started. We find ourselves today facing similar challenges. We have a global economic system that's been upended, supply chains that have been disrupted, and in many places, local economies that are on the brink of ruin. We've got to rebuild not only locally, but the challenge I think we're looking at is how do we reconfigure the global economy? That's a monumental task, and it won't be one that will be completed in isolation. There's no country, regardless of its economic might, at the start of this pandemic that can go it alone. We'll have to work with our commercial enterprises to reconfigure the global trading system, not just to recoup losses, but to position ourselves to withstand the next inevitable pandemic and the one after that. Regarding supply chains, we can no longer put all our eggs in one basket in the pursuit of short-term profits, but we also can't close the door to the outside world. It doesn't matter how some people feel about globalization. Like viral pandemics, it's a fact of life that we just have to learn to live with. While we struggle to pull ourselves out of our current predicament, it's also, I think, the time to mount a full court press to reinvigorate international cooperation to cushion us against future shocks. As has been mentioned, international cooperation is essential to dealing with problems of this magnitude. We must increase our diplomatic activity to reinforce traditional alliances and build effective relationships in recognition that we are occupying one big spaceship. Its passengers a diverse collection of humanity whose very survival depends on cooperation, not isolation. The point guards of that effort are our diplomats, working at home and abroad to advance our national interests with due consideration to the inescapable fact that our interests are intertwined with the interests of the rest of humanity. We have to take action to recruit and retain a sufficient number of people representative of this nation's diverse population and ensure that they are educated, trained, and equipped for the tasks that lie ahead. For us here in the US, that means that we have to reassess our attitude about the risks involved in conducting diplomacy. Our current risk avoidance posture has to become one of risk management and mitigation. We have to provide our diplomatic service with visionary leadership, political will, organizationally, and unwavering support for what they will need in the coming decades to enable them to do their jobs effectively. History doesn't have to repeat itself. With sufficient resolve and determination, we can rewrite history. Our goal, though, should not be to return things to the way they were. Restoring the status quo, I don't believe, is an acceptable solution. We need to build a new international economic system that meets the needs of people and society and that has the resilience to cope with the uncertainty of the future. In short, we need to build a better system and we need to work together to get it done. Thank you.
Thank you very much, Charlie. And thank you for your support of the academic work on the role of diplomacy in world affairs and the American Academy of Diplomacy. In this connection, we're going to move on to our next speaker, and we're delighted to welcome back Ambassador Simonovic from the Embassy of Croatia. As many of you know, Croatia is currently holding the presidency of the Council of the European Union, and Ambassador Simonovic also participated in some of our academic work before and contributed to our publications. Ambassador?
Professor Alexander, dear Yona, ladies and gentlemen, it's a great pleasure being with you today. What I would like to address is as briefly as possible, not abusing your patience, some aspects of the economic fallout of the pandemic. And in that regard, I would like to address two issues, basically two pairs of issues. And these two pairs exist in they have a slight friction or certainly correlation between themselves. The first pair of issues is the relationship between the Wall Street, the markets, the stock exchange, and on the other side, the real economy or the Main Street. And on the side of the Main Street of the real economy, we have indeed seen a total devastation. We have seen closures. We have seen a record unemployment, the crashing down of the manufacturing and the industrial output. Some sectors of industry have been devastated. Some of them have been mentioned, such as cruise shipping industry, tourism, traveling, the airlines. Many others, restaurant business, hospitality industry, and they are suffering. Small and medium-sized businesses are getting devastated, and if the longer, of course, the crisis lasts, the worse they will be getting, and with the high level of probability that the substantial amount of them will not be able to bounce back, unlike some of the big companies, some of which are actually have been able to do well even during the crisis. On the other side, you have the stock exchange, the Wall Street, and the basically holding on with a lot of fluctuations, but the being able to keep the head above the water. Not crashing, but not prospering, being uncertain, and the overall analysis is that the massive, unprecedented intervention by the Fed, as well as by the federal government, has been able to hold the line for a while. Everything again hinges on the fact that we all, including the investors and the markets and the industries, counting on a crisis really limited in time. If it is not limited in time, it's basically beyond our ability to comprehend all the spillovers and fallout which may be coming out of that. So we are counting on something which we would be able to hold down, which we would be able to control with either with the measures of social distancing, hopefully with vaccine, a reasonable treatment within a reasonable time frame. So that is, I guess, the assumption which is holding the stock market as well. That the investors are counting on us all. I'm referring primarily to the U.S. market, which is very much substantially influencing what's happening around the world. So everything is based upon the assumption that we are slowly, gradually, in a phased manner, getting out of it. And in that regard, this relationship between the Wall Street and the Main Street, we may be seeing, hopefully, looking at the bright side, that the venture capital hedge funds, that the capital which still exists, which has been certainly undermined but not totally eroded, they would be able to pull to act as a pull for the reasonably fast recovery. an eventual crash of the markets would be again devastating, not only for the markets themselves, but for the real economy, for the main street, and it will be certainly a chain reaction around the world. So it seems that there may be a glimmer of hope in this unusual relationship in which we have the markets reacting better to the scenery, to the bleak scenery the real economy has, and with some hopeful, enlightened governmental interventions, and indeed also with the reassumption of the international trade, we all, the U.S. and its allies and the global markets and the Croatia, European Union countries, we may be on a reasonable way of recovery. The other issue, the other relationship I would like to address briefly is the friction between the globalization and the protectionism, nationalism, if you wish. This is not this friction has been a pre-existing condition of, if you wish, comorbidity of this coronavirus. It has not been born by the coronavirus, but it has been several times multiplied in an exponential sense. We have seen that the supply chains which have been internationalized, some of them in a very awkward manner, searching for profit and for following the logic of outsourcing everything according to the low labor costs, have been highly detrimental for all our developed industries, that we ended up not being able to produce simple products such as masks. Okay, or indeed we did it by shifting the other industries, but we were amazed in Croatia, in the European Union, in the US, to realize that what we don't produce, and several decades ago we were producing these things brilliantly. So what will be happening? It's hard to look into that crystal ball. I would surely I think that it would be within the reason to say that we have learned during this pandemic would not lead us into an autarky. That would be economically suicidal. We would not be able to achieve economies of scale. Even that is applicable for smaller countries, but it is applicable to a different extent also to the largest of countries. But certainly every country, and I will certainly that advocate for my country, we will be looking very closely into a necessity to have a reliable supply chain, production chain. I would advocate, for example, to look more closely into establishing these chains within close allies, which are reliable to each other. And we would all have to also look to the things which we have domestically. I would maybe use a term strategic self-sufficiency, not autarky. It would be totally detrimental to our economies, and it would not work simply. It's not going to happen, and it would be detrimental for the progress in the world if we each and every country would, doing it individually. This will not happen. I don't think so. But strategic self-sufficiency, taking good care what we can produce, what we should have to cover all bases, reasonably addressing all realistic scenarios. We have been neglecting this threat for a long time, despite the fact that it was well known to the scientific community. I mean, I'm talking about the emergence of emerging diseases and their pandemic potential that has been known by scientists and taken into account by the national security professionals. But again, we are again surprised. So what I think, what I also hope, that would be within this debate between the kind of full unregulated globalization, and on the other side the full protectionism and nationalism, that we will be having again certainly something called strategic self-sufficiency, and the certainly readjustment, but the not a total collapse of a globalized world in terms of the international trade and in terms of the global production chain. But there will be a lot of readjustments. You may call that readjustments also a certain revolution, but us doing things jointly will not disappear overnight. And also, I think, and that has been said by some of the preceding speakers, a stronger, a closer international cooperation, both in terms of the addressing this ongoing pandemic, as well as in working on our recovery, is also very much should be very much something we should be able to address jointly. Again, the whole like-minded community of nations, but involving everybody, and being directed very much also to those much less fortunate economically than us. Talking about some parts of Africa in the first place, and because if this pandemic has demonstrated anything, it has demonstrated in a most brutal fashion interconnectedness and interdependencies of the modern world. Professor, ladies and gentlemen, thank you for your patience. Pleasure being here with you.
Thank you very much again for your contribution, and we would like to move on to our last but not least commentator, Dr. Nicholas Rostov. Formerly, he held very senior positions in the U.S. government, including the National Security Council, and advisor to all the way back to, I think, President Reagan and H.W. Bush and so on, and academically contributed to our work for many, many years, most recently the National Defense University. Nick?
Thank you, Yona, and thank you all. This has been a very illuminating conversation, and I'm conscious of the fact that it's already past the closing time of this webinar. And I think there's a richness to this discussion, which I hope will be captured and passed on, because frankly, I'd like to start with two observations. First of all, from an environmental point of view, COVID-19 has been the best thing that's happened to the planet probably in over a century. And secondly, the entire world got a lesson in leadership from the 93-year-old monarch sovereign of the United Kingdom, which no one has come close to matching. And we in the United States have been in a panic. And we haven't had a Roosevelt to say the only thing to fear is fear itself. And we have forgotten the importance of process in dealing with facing situations where unknowns outnumber the knowns. And so what I'd like to do in closing this session really is to tick off just some processes that we need to go back to and remind ourselves of and think about in terms of the next crisis, because we don't know if we're in the eye of a hurricane. I was speaking to a friend of mine who's been leading the North Dakota University task force on COVID-19, and he said, we don't know if we're in the eye of the hurricane with another wall of it to pass by, or whether the hurricane has passed by. We don't know. So, but we all, just about everybody on this, in this webinar have participated in dealing with situations where decisions have to be made based on very imperfect information. And we need processes so that we can continue to make decisions, but adjust to as facts emerge. And this whole affair has highlighted just how little is and was known. And it's highlighted the fact that we've revitalized almost instinctively intergovernmental and government and private industry cooperation, but the federal system just hasn't worked as it's typically does or has in the past, and that's a failure of leadership. Now, I would say that what has worked has been the empowering by necessity of local actors close to the problem, and they're the ones who have to deal on the ground with the pandemic and its effects, but they haven't been able to address the problem of panic. And what I've done is to enumerate a number of issues that I think we all have touched on, but need to be addressed going forward, because there will be, as everybody has said, pandemics or crises in the future. And we just can't, I mean, if we're flat-footed again, that's our problem, not the fact that we just shouldn't be surprised by this sort of thing. And one of the first things that I think this pandemic has shown is that the incredible dependency we all have on a cyber world, an interconnected world, and yet the fundamental infrastructure is insecure and not hardened. It was invented with nothing like the current usage and demands on it in mind. And the protocols date from the 1960s when, Arpa, now Darpa, invented the internet. And nobody's gone back and fixed it. And it's just one of the essential things. If going forward, we are going to be ever more dependent on the cyber world, then we have to be as more confident than we can be today about cybersecurity. Then this whole episode has thrown into relief, sharp relief, that the future of work is a big question to which no one yet has an answer. Education, it may be that distance learning is going to be more normal in the future than it has been up to now. But people who participate in distance learning, whether they're school children or college-age children, know, and teachers know, it's not adequate. It's not the equivalent of a multidimensional experience in a classroom. This seminar is useful, but it's not as good as it would be if we were together. We need to harden our energy production system. I mean, there are just tremendous risks to the energy system, whether it's electromagnetic pulses or volcanic eruptions or terrorist attack. In my view, our foreign affairs and national security interagency process needs to be revitalized. That's not going to happen under this administration. And there are human insecurities that will need to be addressed. I mean, people have been shaken. Their confidence has been shaken not only in themselves, but in institutions and in individuals. how that gets rebuilt and what the long-term consequences, sort of social, psychological, are is a matter of great concern. The pandemic has highlighted the need to think through what kind of health system do we need, and what kind of public health system, and what kind of public health resources. The idea of making it public health, again, a national security concern, I think is a very, very good idea. What happens to research when something like a pandemic shuts down the economy? Life science research can't just be started and stopped, for example. And there's been talk about stockpiles. What are needed? How do you stockpile material, unlike petroleum, which degrades over time, and even petroleum, I guess, degrades. And of course, the transportation and urbanization problems. So what I'm saying is not that anything new or different from what you've all said, but rather we need to institute processes and training programs so that we are not caught flat-footed. And we need to figure out what are the kinds of things like fire drills that we need to go through on a routine basis so that we have national muscle memory to call on, and that whatever lessons are identified from this episode get learned instead of just put on a shelf. So thank you, and I'm sorry to be the last speaker, but this was a terrific webinar, and thank you for including me.
Thank you very much, Nick. Professor Don Wallace, would you have the last word?
Well, I'll have a few words. Thank you first. Yona, you've really put together a wonderful group of old friends and new ones. I think one thing we should keep in mind is this will pass. I mean, something horrible may come later. A year or two or three from now, things will be different. And we really should keep that perspective, number one. Number two, you mentioned Queen Elizabeth. The British in the old days were known for their muddling. My wife is English. We'll muddle through this, through our constitutional decentralized system. There's been so much thought here. I do think one thing, we must have more faith in ourselves. I used to, in any of these programs, I've always said we should be more stoic. We're not going to be, but we've somehow got to develop that. On the other hand, this very webinar proves how much energy we have and relatively how much consensus there is. Even with Ambassador Hunter having a slightly different view, there is real consensus here from the left and from the right. So I remain really an optimist. In fact, that's the only possibility. One final personal note, Robert Kahn was my client, the developer of the ARPANET. I wonder what hath Kahn wrought, and Vince served with him. But Yona, keep the faith, stay young, do this again, and Guy, it was nice seeing you before. So let's carry on and have some more of these, and maybe we can have some impact in some way. So anyway, thank you, Yona, very much. Thank you all. Thank all of you.